Good afternoon, countrymen and women, and good afternoon, members of the press. I'm privileged today to address you and update you on the COVID-19 outbreak in Zambia. In the last 24 hours, Zambia tested 99 cases. 99 tests were conducted, and these tests involved people who are contacts to the confirmed cases, and the results have shown that none of the 99 cases was positive. So out of the 99 tests, 0 tests came out positive. Therefore, in the last 24 hours, we have not confirmed any laboratory confirmed cases of COVID-19, and Zambia still remains at 36 cases of COVID-19. This brings us to the cumulative total of 619 individuals tested by end of yesterday, and we continue to test individuals who are in the matrix of the contacts of the people that have tested positive. All the 36 cases that we have tested remain under isolation, and all except one are exhibiting mild or no symptoms. The patient who had severe symptoms continues to be on O2, but is not deteriorating. I'd also like to inform the nation that over the weekend, out of the alertness of the public, our Public Health Operation Emergency Center was alerted of a number of cases in the community at some lodges and in some residential places. What we have picked from the 5 cases that were picked by our rapid response teams and admitted in our isolation units is that all of them were negative and they've all been discharged. If we look at the global picture, 859,431 cases of COVID-19 have been recorded, and 42,335 deaths have been recorded as of today, 1st April 2020. And as I talk about these figures, be rest assured, I am not fooling anyone, because I know 1st April is Fool's Day. In Africa, the number of confirmed cases stands at 6,118, with 199 deaths in 50 countries and territories. As we continue to implement strict measures, including screening at points of entry, the government has secured a suitable place for trucks carrying commodities into and through Livingstone and other border points, while the drivers remain quarantined for 14 days in designated places. Rapid response teams have been identified that are able to fast-track screening and testing for drivers who are carrying essential commodities in order for us not to disrupt trade. Further, a technical team has been dispatched to Livingstone to strengthen capacity for port health services, as well as strengthen coordination and response to COVID-19 at district level. We have been conducting tests only in Lusaka at the virology laboratory at the Investigation Hospital, and also at the veterinary laboratory at the University of Zambia. We have now expanded our laboratory capacity and started doing tests at the Tropical Disease Research Center in Ndola, and therefore the northern region will be supported in terms of diagnostic capacity by TDRC. Tools, reagents, and other necessary commodities have been provided, and technical teams are now trained and are ready for expanded provision of COVID-19 diagnostic services. Zambia continues to participate in regional initiatives for responding to the COVID-19 pandemic, and at SADC level, 11 key areas have been agreed upon by member states for a coordinated response to the pandemic. And these include preparedness and response, surveillance, diagnostics and laboratory testing, risk communication, facilitation of movement of goods and services, regional trade, regulatory issues, and disaster risk management. Countrymen and women, I wish to re-emphasize that to win this battle, we all have to play our role in ensuring that COVID-19 control measures are effectively implemented. Let us stay away from Lusaka, and let us avoid taking the infection outside Lusaka. Let us stay home unless we are essential workers providing health services or security services, or selling or buying of food. Let us keep away from public gatherings. Let us worship from home. Let us not engage in public gatherings. Let us ensure that we minimize the risk of person-to-person transmission. Let us wash our hands, and let us maintain the highest levels of personal hygiene. The government of the Republic of Zambia, under His Excellency Dr. Edgar Chagwalungu, continues to place health security at the apex of its health agenda to protect the public from any health hazards. To this effect, we are executing a scalable plan that is sensitive to the data that we get as the epidemic evolves in Zambia. Today, in order for us to strengthen our focus on prevention, including surveillance, contact tracing and testing, treatment of cases in our isolation facilities, as we focus on all interventions that are part of this response, government has made some significant decisions to enhance the response. His Excellency the President of the Republic of Zambia has authorized the recruitment of 400 doctors in order for us to support the response, and in excess of 3,000 paramedicals in order to support the response. The recruitment will commence today. Further, we call upon all citizens to adhere to the measures that His Excellency President Lungu announced in order to scale up the response. Stay home, stay away from Lusaka, wash your hands, keep your environment clean. Only essential workers should be at work. Otherwise, let's work using technology. Let us ensure that we do not interrupt essential services. Let us avoid public gatherings. The health workers that are working at the front line today, I want to specifically salute you and urge you on. And as His Excellency has directed recruitment of more health workers, he has further directed that incentives be provided for the frontline health workers at the helm, at the front line of this scourge, in order to motivate them to support or to continue providing service. This is in recognition of the fact that these are the heroes and heroines who are protecting the nation from these public health hazards. And in appreciating you and urging you on to continue diligently serving the nation, the President has not only ordered recruitment of more staff, but has also ordered that incentives be provided for the frontline staff that are in the course, and details shall be availed in a different setup. Distinguished ladies and gentlemen, this is where we are today. 0 new cases out of 99 cases, 5 discharges from the 5 alerts we got over the weekend, a call to stay away from Lusaka, a call not to leave Lusaka, a call to remain home, a call for hygiene, a call for hand washing, a call to ensure that we are alert and report any suspects, and a call for solidarity from all to ensure that we form a common front to this pandemic. I thank you all.
Thank you so much, Honorable, for that update. So we've heard it, no new case reported today. So we'll take some questions from the public so that I think we can mix it. Yes, we'll take 3 at a time. Gentleman behind there.
Absolutely, gentlemen. We commend the minister and the government and the state government, and the call also to...
Could you tell us please your names and where you're coming from?
My full names are Inamba Ostora from the Biomedical Union of Zambia, General Secretary. First and foremost, I'd like to appreciate the stance that the government has made now, and also many other stances that have made in the past in the fight against COVID-19. Furthermore, we'd like to appreciate the role that government has now also taken to ensure that more frontline staff are actually employed and also incentives are put in place. We thank you, government, and we keep on appreciating and we keep on fighting this battle. Thank you very much.
Thank you so much for the kind words of solidarity and support from the Biomedical Union of Zambia. We appreciate your kind words.
Thank you. Any more questions, clarifications?
Well, there being no more questions, I'd like to invite our friends from the corporate world who are working with us in order to enhance the support to COVID-19. And ZCCM-IH, you have the floor.
Good afternoon, Honorable Minister. Honorable Minister Dr. Chitalu Chilupia, Permanent Secretaries, Ministers here present. I would like to start by applauding government for the measures put in place to help manage and contain the spread of the COVID-19 in the country so far. By way of introduction, my name is Mabuto Chipata, Chief Executive Officer of ZCCM-IH. Honorable Minister, the constant updates have been helpful in managing the situation and keeping the nation informed. At ZCCM Investment Holdings PLC, we hereby donate an ambulance towards the fight as a way of joining efforts with government in combating this global epidemic. The state-of-the-art Mercedes-Benz ambulance, valued at about 100,000 United States dollars, was secured from Perth in Australia in collaboration with Health Hope Zambia in 2018. Health Hope Zambia is a charity organization led by Brendan and Portia Clark and have been instrumental in securing various medical equipment and furniture from state-of-the-art hospitals in Perth, part of which we donated to Ndola Teaching Hospital in 2017, and we saw them donate some to UTH in June last year. The ambulance we are donating to help with the fight against COVID-19 is part of this consignment, and it is equipped with resuscitators, among other things. We would like to thank the ministry for accepting this donation, and we hope that this will go some way in fighting the scourge. Thank you.
The CCMIH would like to thank you profusely for this generous donation, and would like to urge all the corporates to benchmark you in supporting and working with government in times of adversity. We thank you most sincerely, and this is the way it should be. That ambulance will go a long way in enhancing movement of patients from one place to another in the referral system that has been set up specifically for the COVID-19 response. So we thank you most sincerely. Let's have Zambia.
The Honorable Minister of Health, Dr. the Permanent Secretary, President, and Directors present. The Zambia Medicine Regulatory Authority, ZAMRA, recognizes government's effort and the various measures that are put in place to prevent and mitigate the spread of the coronavirus. Honorable Minister and distinguished guests, ZAMRA has joined government and other stakeholders in fighting the outbreak of coronavirus through, among others, sensitizing members of the public on preventive measures as guided by the Ministry of Health. Ladies and gentlemen, as a way of supplementing government efforts, ZAMRA is today donating a consignment of alcohol-based hand sanitizers valued at 50,000 kwacha. Honorable Minister, our donation is in response to one of the key interventions in effectively preventing the use of alcohol-based hand sanitizers. Honorable Minister, ZAMRA has also continued to urge the pharmaceutical industry to ensure that all medicines and allied substances such as hand sanitizers, disinfectants and medical sundries, face masks and medical gloves made available to the Zambian population meet the required set standards of quality, safety and efficacy. This is important as it will help to ensure that public health is protected during this fight against the COVID-19 pandemic. I thank you all.
DG ZAMRA, we place on record unfettered gratitude for your generosity donating towards the fight against COVID-19. Your donation of hand sanitizers will go a long way in promoting infection prevention through effective hand washing and through effective hand sanitation, hand hygiene rather. So we want to thank you sincerely for this generous support. And let me take this opportunity to urge you to work closely with stakeholders to expedite the registration of contemporary products that will support the fight against COVID-19. We thank you for what you're doing as ZAMRA. Thank you very much indeed. Let's have the National Health Insurance Authority, NEMA, DG.
Honorable Minister, Cabinet Secretaries from the Ministry of Health, Directors from the Ministry of Health, ladies and gentlemen. For NEMA, the National Health Insurance Management Authority, solidarity is our byword. And when our country and our communities are afflicted by disease, the people's scheme makes sense for us to rise in solidarity, to come and be part of the people, the owners of the funds. Honorable Minister, what we have done is that the National Health Insurance Authority has decided to provide advance claims to hospitals. In this way, we are saying that hospitals, as front lines of this battle, must be battle ready. In this case, the first few hospitals that we've accredited, that have signed and passed the accreditation form, will be presented with checks today through your hands. I must say, Honorable Minister, that these advances we are presenting to the hospitals are carefully designed to be claimed back against future claims that the hospitals have already started preparing. From NEMA and on behalf of our board, we want to send a message to your army of healthcare warriors who are at the forefront, who are in the trenches fighting this disease. We are with you. You are not alone. You have chosen to be at the forefront when comfort and security could have been at the back of the line. We are praying with you and for you. We also know that you are performing acts of utmost sacrifice, unheralded acts of heroism. Honorable Minister, there is no sacrifice, there is no love greater than this. Our heroines and heroes deserve support. At this juncture, Honorable Minister, if you may allow, I would like to invite the SMS from UTH, and with your indulgence, so that you can present that tummy check to UTH on behalf of the other three hospitals.
It's not even like this because you come into the elbow, but we greet by our feet. So thank you so much, and thank you so much. The National Health Insurance Authority, cornerstone of President Lumbu's transformational agenda in the health system on healthcare financing. The vision of His Excellency, the President, Dr. Edgar Lungu, in health is powered through a reformed, a reinvigorated healthcare financing mechanism. And the milestone that has been posted early is the National Health Insurance Authority. This has introduced a prepayment scheme. This has removed the out-of-pocket payments that have been expensive for our citizens. This has been a key step towards universal health coverage. This has eased the suffering of many citizens. Today, we see the dividend of such an innovative program. We see not only front-loading of our institutions with resources to make them battle-ready for the COVID-19, but we see an institution that stands in solidarity with the people of Zambia in adversity. This must be commended, and this is as it should be. And I put on the table unfettered gratitude on behalf of the people of Zambia and the broader government. And please keep up posting such milestones. Our people in Imbala who are dealing with a lot of public health threats through the borders. Our people at Levy, where we are, where the isolation facility with the Atmos Treatment Center is domiciled. UTH, the apex of our clinical care infrastructure, have all been supported, have all been front-loaded with resources that will make them ready to support the response. We thank you most sincerely, DG, Nima, and your team. Let us have the Biomedical Association of Zambia.
Honorable Minister, Permanent Secretary, media, ladies and gentlemen. From us, the Medical Union of Zambia, we recognize the partnership that we have with the Ministry of Health. And as the smallest union, actually the smallest union, we have decided to join the fight against this pandemic. And in our joining this fight, we have a little contribution that we want to make, a donation that we want to make to the Ministry of Health, looking especially at the efforts that we have already made. We have made a little donation of 300 laptops that will be donated to the hospitals, and also 600 masks that we have procured for our laboratory personnel that will be donated to the Ministry of Health. It is actually our happiness, Honorable Minister. Even when we were seated there, we had the General Secretary saying we are so thankful that you have decided to increase the numbers of the ground that are actually in the forefront, in the front line to fight this pandemic. I'm Mr. Mwembe, President of the Medical Union of Zambia. Thank you.
Well, thank you very much. When associations of professionals turn up to hold hands together with government in order to support a common cause, then we know that we are united in purpose. And again, we should urge all other professional associations to emulate what the Biomedical Society of Zambia has done. This is as it should be, and we thank you most sincerely, Biomedical Association of Zambia, for that generous support. Together, we can overcome COVID-19. Distinguished ladies and gentlemen, as we sum up today, I'd like to recognize Professor Babu, a public health guru, who has been our teacher in public health. Should I betray your age? 81 years old, and has been in Zambia and the University of Zambia for more than 49 years. Yes, we thank you for coming through. It shows that you still want to continue mentoring us, even as we fight COVID-19. Distinguished ladies and gentlemen, as we come to the close today, highlights are that 99 tests done with 0 positives. In order to reinforce the fight against COVID-19, in order to reinforce surveillance, case management, His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwalungu, has ordered recruitment of 400 medical doctors and 3,100 paramedicals. And this is only in the first phase of the response. Further, His Excellency President Edgar Chagwalungu has directed extra incentives for the frontline health workers at the battlefront, for he recognizes the sacrifice, the patriotism that our health workers at the front line have put in. He is thrilled and touched by your commitment to Zambia, and he urges you on, and he says he stands with you as you wage this fight against this grave threat of the Covid-19. Furthermore, would like to emphasize, colleagues, countrymen and women, that COVID-19 is a formidable enemy. We can overcome it. Let us ensure that, one, we prevent new cases coming in, and therefore let us participate in the response to restrict entry into the country of people from COVID high-risk countries, and should they enter, let us ensure quarantine mandatorily for 14 days until certified COVID-free. Let us ensure that we participate in community surveillance, and in surveillance and reporting any cases that are suspicious to authorities, and we thank the community for being proactive. Let us ensure that we improve personal hygiene, hand washing, and where we have no soap and water, we use sanitizers. Let us ensure we all wear masks. Let us ensure that even as we talk about restrictions in movements in and outside Lusaka, as we talk about restrictions within Lusaka, let us ensure that when we go to the market to buy food, to the food store to buy food, as we go appear in public places, we put on masks. A question arises: what type of masks? Look, even the homemade mask made out of cotton is good enough. It is reusable and you can wash it. We want to encourage all those creative citizens who can make out of cotton, out of cloth, out of material that is available in our home states, masks that are reusable. Those are still good enough. Let us ensure that we create a barrier between ourselves, who may have symptoms, and the next person who is asymptomatic, or between ourselves who are symptomatic and the next person who is symptomatic. It is the best way to protect yourself. Put on a mask. Put on a mask. And I appreciate the participants in this press briefing today. All of you are in masks. I further want to emphasize the need for us to ensure the environments we are operating in are clean. If we are trading in food, let us ensure that the environments we are trading in are clean. There are provisions of the Public Health Act, statutory instruments 21 and 22, that will compel all of us to ensure certain minimum levels of hygiene in our areas of practice, or we face closure. And now, to avoid disruption in our routine and in key activities of trade and commerce, we want to engage with you and ensure that there is adherence to the guidelines that the President gave. Let us ensure social distancing. Let us ensure that the environment is clean, and let us ensure hand washing and only essential movements. The private sector, the public sector are all urged on to ensure that only essential services and workers are let to go for work. The others should stay home. Let us ensure that we disrupt person-to-person transmission. This can be attained if all of us have civic responsibility, are disciplined, and recognize that we can actually face a flare-up if we do otherwise. Distinguished ladies and gentlemen, discharging 5 people from Levy Hospital, stable and back home, is a milestone, and we want to appreciate our health workers for that great work. We also want to appreciate our staff who are involved in surveillance and urge them on. We will ensure that commerce and trade continues by ensuring that those truckers who are coming in with essential commodities are rapidly screened and escorted into places where they will offload their merchandise and are isolated, and they leave the country without infecting anybody. Colleagues, countrymen, ladies and gentlemen, it is important to note that the health agenda that His Excellency President Lungu has embarked on in Zambia embraces health security. Health security protects all of you from public health hazards. Let us work together, hold hands in solidarity, and let it be said at the end of it all that we fought COVID-19 off as a collective. I thank you for coming. So, Nima, take a picture from here. Nima, so who wants to? Yes, my name is Chipata from DCCM. I want to show you. Are you from Papa? Come here. Where's Nima? Okay, while Nima is preparing, let's be at the DCCM. I'll show you. Biomedical? Oh, right, okay, here. We're actually going to, as part of that recruitment, more than 600 will be laptops. More than 600 will be laptops. Let's work together to identify a number and order of